Good evening and welcome to this live session from MAHSA University, Sarjana Putra campus. I'm Nitya, lecturer from the Faculty of Education at MAHSA University, and I'll be moderating today's session. Today's webinar titled Music Therapy in Thwarting Cardiovascular Disease is proudly organized by the Faculty of Sciences, MAHSA University. Before we proceed, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences at MAHSA University. Faculty of Health Sciences, Nursing and Education, these are the courses at faculty. School of Education, School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging, and School of Nursing. So under the School of Physiotherapy, these are the programs. Department of Environmental Health, these are the programs are offered. Department of Medical Imaging, these are the programs are offered. Why join health sciences? High job demand, essential services, no boring work routine, lucrative remuneration, low risk of job redundancy, opportunity to work in variety of settings, a career you can feel good about. So Master of Physiotherapy, 1 year program, 2 year program. We do have full-time and part-time. So these are the entry requirement. So these are the courses for under the bachelor. And the entry requirements are follow as this. Diploma programs, diploma in physiotherapy, diploma in environmental health, diploma in medical imaging, and these are the entry requirement. And diploma in occupational safety and health is a 3 year program, and these are the entry requirement. So why choose Faculty of Science, Health and Science, experienced and dedicated international pool of academic staff, various study modes, cross-teaching by expert, interactive teaching and emphasis on hands-on clinical skills, wide list of hospitals institution for clinical and industrial placement, aggregated by the NQA and JPA with international recognition. So MASA Scholarship, Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teachers Scholarship, Family Scholarship, and the Single Parent Scholarship. So these are the collaborations and affiliation. World Confederation for Physical Therapy, Malaysian Physiotherapy Association, ARU, ARIO, Student Mobility Program with ARIO Society University, Lovely Professional University, and this will be the last Student Mobility Program. So we welcome you to join us. Thank you. So please feel free to contact us through the MASA website or our faculty's Facebook page to learn more about our programs. You can also leave a comment and we will get back to you. Introduction of this webinar: music can enhance the enjoyment of exercise, leading to increased physical activity and improve cardiovascular fitness. In today's webinar, we will be explore how the appropriate selection of music to accompany exercise can help optimize cardiovascular health through various mechanism. Now, let me introduce today's speaker, Mr. Rajan Balakrishnan, lecturer at the School of Physiotherapy, Faculty of Health Sciences, MAHSA University. Mr. Rajan holds a master's degree in physiotherapy, specializing in cardiorespiratory physiotherapy, and is currently pursuing his PhD. He also holds a certificate in music therapy from Spain and has been an educator for over 18 years. Mr. Rajan, the screen is all yours.
Thank you, Mr. Nelson and Ms. Nitya, for a brief introduction about the webinar. I wanted to take a moment to express my heartfelt gratitude to our Dean, Associate Professor Dr. Veronica Chua, Faculty of Health Sciences, Nursing and Education, for giving the opportunity to participate in this webinar. This webinar will give you a valuable insight on how the music and its characteristics will help us. It will provide a holistic approaches on music and health disease. So without waiting further, we can go enter into the webinar. So our webinar title is Musical Therapy in Thwarting Cardiovascular Disease. See, thwarting stands mainly for how you are going to prevent the cardiovascular disease. So it is basically a rehabilitation method for the cardiovascular patients. So table of contents, what we are going to see in this webinar: history of music, introduction, characteristic of music, preference of music, music in education, and physiological effects of music, different brain waves and physiological effects of different brain waves, and musical therapy used in medical practices, musical styles, theoretical model of musical therapy, and we can conclude with our musical therapy. So when we are entering our history of music, in the primitive stage, the music is used for the purpose of dance, funerals, rites, and weddings and birth. Humans always huddle with the music from the day of birth to the day of death. So in the primitive stage, in the Egyptians, they used the music for a curative treatment. So always they depend upon the music to curate any ailments. The Greece and Rome focus on the individual characters and identify. They use this as a how to differentiate the human beings by the way of the character and their identifications. Renaissance, music is used as a medicine, and it is used in the modern medical purpose also. Baroque period, music awakes patients about the feelings, emotion, psychological aspects. In the 19th century, the term music therapy emerges and it is used in the education purpose. In the World War I, attending to the wounded with the similar issues. For example, they will provide music, thereby they make the patients a pleasant comfort zone. In 1950, creations of the American Association of the Musical Therapy. So nowadays, the music therapies have a specialized training and continue to grow. So before going that, we should know what is music. The music is an art of combining sounds, different sounds. Maybe it is a high pitch or low pitch, any pleasant sounds will make you feel. So the art of combining sounds we generally produce as aesthetics or expressive effect that results in something pleasant to hear, how you make you comfort. That is a music. Therapy, a process that is carried out for the purpose of healing, alleviating, or improving problem, symptoms, and illness. So we go for the introductions. The musical therapy involves music and all of its facets in a process that is meant to help the individual, maybe our groups, learn different skills such as communication, learning, moving, expressing the emotions. Everything fundamental is music. All of these elements work to improve an individual physical, mental, social, and cognitive abilities. If a person is very indulged in the music, complete his health is in a good state. Music therapy aims to develop or restore an individual different ability to improve interpersonal skills with other individuals and intrapersonal skill within oneself, which ultimately lead to the higher quality of life. Music therapy as a treatment for an individual, physical or psychological rehabilitation. The music therapist, in this case, may be the same professional who work as a doctor or a psychologist because they have also been trained as a music therapist or anyone who has a formal education in music therapy. They treat their patients working with other professionals such as a doctor, psychiatrist, psychologist, and so on. This practice involves a strict methodology and a well-defined therapeutic framework. So before entering into our music therapy, we have to know a basic characteristics of music. The positive effects produced by using these kinds of activities or workshop in socio-educational activities or interventions are primarily related to the specific characteristics of music. We having different stage. Our mode of music will change according to our age. So now we are going to differentiate our music in different age groups. Intensive stage, teenage years. This stage is based on music genre such as punk or metal and relates to searching for one identity. Contemporary period, early child adulthood, young but mature. They like may include pop and rap genre. It coincides with socializing and connecting with society in places that play music you can dance to. In sophisticated phase, adulthood, in this stage, an interest in contemporary music decreases and increases for more sophisticated music such as jazz or classical. Researchers believe that this phase coincides with the family and work issues, and individuals tend to look for a way to escape and relax. The music is used in education. Different form of musics. Sorry. Formal education in music educates students musically from first grade to secondary school. Additionally, music is officially taught in specialized music schools and is divided into 3 levels: basic, elementary, professional, and advanced. Informal education is a non-systematized process throughout the life where individuals acquire knowledge, abilities, attitude in connection with the music. So this is what we are experiencing day-to-day life. So we used to hear different types of music and different people and different from the different country. So music education. So music as an end in itself. It doesn't have outside any end. The music as end itself. Define an instructive process based on a curriculum. Courses that are scheduled and organized by levels. It is in a homogeneity. Activities are designed to improve the performance. So it was highly limited and a structured education for the individual. Music as a means of producing changes, open, experimental, interactive, and developmental process. Groups of different levels and ages, value of the performance themselves. So it's completely different from what we are normally using the music. Music therapy is completely having basic approaches and how you are going to apply on the patients. Music intelligence. Music intelligence is included within the model of multiple intelligence proposed by the American psychologist Howard Gardner. According to the Gardner, there is not a one single level of intelligence, but 8 different mode of intelligence, namely linguistic intelligence, your language, different types of languages, logic, mathematical intelligence, spatial intelligence, musical intelligence, bodily and kinesthetic intelligence, and intrapersonal intelligence and interpersonal intelligence and the naturalistic intelligence. So these are all the basic intelligence that a human quality must have. So in that, the music intelligence play a vital role how to control your body. What the physiological effects based upon the music? The music stimulates both hemisphere of your brain and our four different lobes. It overall helps the brain function more effectively. The pleasant music activities, certain chemical substances in our body connected to pleasure, music produces the brain waves related to concentration, learning, imagination, and creativity. Basically, there is a different types of the waves will produce a different effects that we are going to see further. Music is able to regulate one's heart rate, breathing rate, and the muscular tensions, especially on the cardiac muscles. There are different types of the brain waves, namely delta waves with a frequency of 0.1 to 3.99 hertz. Next is the theta waves, 4 to 7.99 hertz. Third is alpha waves, 8 to 13.99 hertz. And fourth is beta waves, 14 to 30 hertz. So this is based upon the frequency. Now we are going to see how these waves play a vital role in the human body. Delta waves, our brain waves can never completely reach zero activity, as that would imply brain death. Delta waves are produced when we are in a deep sleep. When we go to bed, our brain waves go from beta to alpha, then theta to finally to delta. So this is why maximum of people try to hear the musics during at the night times. So this will take you to the delta waves. It make you to go for a brain sleep. Theta waves, we reach these waves when we are in a state of deep calm. In this state, our task became automatic and we do not need to have a control over the situation. This allows us to distance ourselves from the situation. For example, we produce these waves when we are daydream. It also happens when we have been driving for a while and we realize we do not remember having driven the last few kilometers. We can see our friends or some of our close, they always hear the music when they're driving. So this is the reason why they are, because of the production of the theta waves. Alpha waves, they represent a low brain activity. They are slower than beta waves. A person who has just finished their job feels satisfied with the work will emit the waves. It may also include someone who is taking a walk and enjoying that time. So whenever we completed our heavy works, we need some leisure time or we want to cool ourselves, we will go to activate these alpha waves. The beta waves, the brain is awake and engaged in the mental activity. These are large waves and fastest for transmitting the information. They imply intense mental activity. We emit this wave when we are solving a mathematical problem. So it's a very good example when we are talking about these beta waves. We know about Ramanujan. He is a father of the mathematical thing. So he used to go to a temple. You sit on place. You want to hear some music. When the music is started, automatically you start solving all the problems. When it stops, automatically the process is going to be slowed down. So that is a very good example how the beta waves, how it be linked with the bell in the temple. Physiological effects of the waves. Music is capable of impacting an individual movements. An individual heart rate and blood pressure are influenced by the volume and rhythm of the music. That is, they increase with the faster pieces of music and relax with slower pieces of music. Our breathing rate acts similarly to our heart rate and follows a rhythmic pattern that can be modified by auditory sound stimuli. As a consequence, slow songs help us to breathe more deeply, which usually lead to a peaceful state and emotional self-control. However, if the rhythm is exciting, our breathing accelerates, usually related to the impulsive behavior and distracted thinking. So not only in this like a theoretical way. So in the year of 2000s, when we are be posted in Madras Medical Missions, one of the leading cardiorespiratory unit, one of our lecturer is doing his research on the music therapy. So he used to give a music, how to calm down your heart rate. So in front, we can see what the difference is happening. Then, according to the University of Maryland, the scientists at the University of Maryland found that the diameter of our blood vessels in the upper arm area increases 26% when we listen to the favorite musics. So, in contrast, when we listen to the music we find stressful, our blood vessels contract 6%. So, this is like vast differentiations when we are hearing the musics. In the music also, favorite musics and unfavorite musics, how the differentiation reaction of the blood vessels is going to be activated there. The research also showed that when we listen to music that makes us laugh, our blood vessels open 19%, and with the relaxing music they expand to the 11%. So, how the music therapy used in the medical practices? Music therapy can be used as a complement to medical treatment with the two main objectives: a purely technical objectives using music as an anti-anxiety, anti-stressful, and a distracting element, and with purely human objective, which improves the patient care to include the reaching them emotionally and the personally. So this is a base. Two things are base for the to get a good health. When the how these musics will help during the medical practice. So when you maintain the emotional and psychosocial, automatically the patients will have the good outcome in the treatment. So in which field in the medical practice these musics are used? Surgical practices to make them very calm, produce the waves, different waves, and make them very calm. Pain treatment, pregnancy, childbirth, rehabilitations, and the palliative care. So we should know like what type of music I want to hear, whether I want to go for the high intensity or whether I'm going to go for high pitched or I'm going to be low pitched or the low intensity. So it is based upon the individual, the need, how they are accommodated, people individual differences, perceptions, what type of music they need. So here some of the example with the high pitched sounds at a low volume. These sounds are pleasant, they help us to feel less sad, increase happiness, and help us to walk. Instruments include the harp, the classical guitar, the oboe, and sounds from nature, such as the bird songs or the river flowing. So, these varieties we call as a high pitched sound but low volume. Then we are having the high pitched sound at the high volume. These sounds warn, alarmers. They are used to mobilize groups, ambulance sirens, trumpet fanfares, calls to action, or even a crying child. These sounds are effective on combating apathy, although they can also increase the irritability. If we add a fast-paced rhythm to these sounds, it encourages people to move and work together. These sounds can be created with the instrument such as the drums, trumpet, or guitar. So during the wartime, those days like in the 14th century, 12th century and all, they used to go for the war song. When they make these sounds, automatically where people will move very fast. So the sounds will generate them to move very fast and do the activity very fast. Low pitch sounds at a low volume. These sounds incite slow movements and lead to states of serenity, calmness, or reflection, which are very useful for relaxation. The double bass and the cello are appropriate instrument and sounds of nature can also be used, such as ocean waves, gentle breeze, or calm breathing. So this also is a type of the musics that essential for the human to have a pleasant. And then next is the low pitch sounds at a high volume. These sounds provoke negative emotion, such as a fear, terror, or danger. The film industry often use these sounds for the horror movie. Example is Conjuring. So we are not afraid of the devil, but the sounds will make you to vibrate your body. So that is a very good example for the low pitch sounds with the high volume. A typical example of this kind of sound is a thunder. So during thunder, we will be afraid of that, right? Because of the sound only, not by the visual thing. So how much duration we have to hear the music? That we having some limitation for that. Duration is an amount of time or a particular time interval. That is the amount of time a sound vibration lasts. Here we can differentiate between the long and short sounds. The duration of a sound depends on the amount of energy used by the source as well as the transfer medium. So this also will depend upon the individuals, how much they want to hear the sounds. Sound reaches the ear in two ways. Some sounds will be directly coming to you, some sounds will be indirectly will affect you. So that it reaches the ear after having reflected of something else, such as a wall. When the reflected sound is heard as a second sound, it is called echo. So only the echo is having a more vibrant. The human ear cannot distinguish an echo from the original direct sound. If the delay if the delay is less than 0.1 second, therefore the reflecting object must be more than 17 meter from the second source for the echo to be perceived. If the delay is less than 0.1 second and only 1 second we did not perceive, this is mean as a reverberation. So only we can have a reverse sounds when the distance is going to be very far. Next, we are going to see different types of the musical style. So we are having many different styles. In that we divided into the 6 varieties. Like for example, a classical music, rock, jazz, salsa, rap, and other. So the classical music, this classical music is differ from the different countries, different people, is based upon their own linguistics. Whereas when you go for very deep into that, we found that there's a lot and thousands of varieties in the tribes variety of classical songs. So classical music is the most common style included in the music therapy because it is linked to the state of relaxation and connection with our inner emotion. So it is not often accompanied by the lyrics and leaves the door open for the different interpretations depending on each group member experience. So when you go for the modern music, they will used to say it's a -1. -1 means there is no lyrics, only you can use the instrumental thing. So it's a variety of the musics we can hear. And rock music, a typical fast and heavy rhythm of a rock, provide our brains with adrenaline. They stimulate the brain and lead to high level of energy, tension, and surprise. This is partly why this kind of music is commonly used in rehabilitation for a neuronal damage or failure. Example, stroke, addiction, and the head injury. Jazz music came to be played by brass bands hired to play in parades, funerals, and parties of celebrations. It is a musical style that produces a stimulating rhythmic sensation of swinging. So especially the tribes, the jazz and all will start from the tribes. So they're having a different instrumentals to make the musics and make the patients to do the movements very fast. Salsa music, it includes different types of drums, timbale, maracas, trumpets, and piano. Salsa music is also capable of moving the listener to imagine and create their own body movements when they hear the rhythm. These movements are inspired by the music, even if they do not necessarily form part of the traditional dance moves. Rap music, rap is usually performed in time to an instrumental track and mostly includes the drums, although it can also be sung in a cappella. Regarding the music therapy, rap provides the possibility to improve the create content both in relation to emotions and personal experiences. Rap can be a helpful style of a music working with the young people because it allows the reader to understand their needs very easy. Tango focus on the intensity and depth of emotions that the humans feel when listening to the tango music or dancing it. So it's a combination of the dance and the music, flamenco music. It is an excellent way to improve one's perception of their own body since it forces the mind to remember all of the steps and one ears to follow the rhythm. It involves intense concentrations that ultimately improve the attention, sense of balance, reflexes, and coordinations. Then we are having a different model in the musical therapy. Theoretical model of the music therapy, active music therapy. What is active one? The live musics. That is, we call this in a very active musics, creating the own sounds there itself, which will make you to do the movements based on a sound as a language. So it will be a linguistic intelligence. It will differ from the people to people, country to the country. used to improve creativity, communications, and decision making. We are having a passive music therapy, recorded music, so that under the film musics, what we are hearing, and some of the cultural musics, already recorded one, the individual receives the sounds. Movement is not much based on listening, used to harmonize the mind and body. So it makes your mind and body to connect in a proper way. Northrop Robbins gymnastics origin expressive is one of the main approaches based on the innate character of the music. So people will differ, the character, their identifications, the characteristics of an individual will differ. Based upon these characteristics, the way of listening the music also will differ. So according to the Northrop, based upon the innate character of music and on improvisation to reach awareness and self-help, welcome and farewell musics are used in each sessions. The sessions leaders give a context to the individual's free expression music. Analytical psychoanalytic origin expressive uses improvisation to symbolize emotions, ideas, memories. Music is a tool for self-examination and self-knowledge. The meaning of each improvisation is discussed and conclusions are drawn here. We having the Benenson humanistic psychoanalytic origin expressive type of approaches. Individuals have a different sound identities that differentiate them from others. This can be modified. Instruments or intermediary elements for communicating and a non-verbal context is used as a mediator. So they will talk by using the musics, not by a text. Then we having the behavioral origin expressive, a cause-effect relationship is established between the music and behavior. It can modify behavior. Music is used because it helps new things. For whenever we feel fear of something to learn, when we are this, according to these approaches, when you are hearing your present or favorite musics and try to learn the new things, automatically it will improve your learning capacity. Guided imagery gymnastics origin receptive. Music stimulates and guides imagination to discover the inner elements and the new perspectives. By means of the guided imagery, we reach self-knowledge, self-expression, and spiritual perceptions. The sessions guides delves into an imagery and makes a meaning clear. So this type of the musics will have be deeply enrooted with your spiritual activity and the psychological aspects. Thereby, your good health will be maintained. Delcro's approach, rhythmic method, a musical education is carried out through rhythm. Rhythm is like, it is not intermittent, it is a continuous one. If you are hearing this music continuously, you can have the continuity of the flow of the waves in your body. Thereby, there is a lot of good physiological benefits to your body. Rhythm is a muscular discipline that is based on activities where the meter is marked with improvised arm movements and steps. So it also improves the movements of the upper limb of all the joint. Kodali approach. One's voice is the first instrument. Singing is the base for the musical activity. Instruments are less important than voice and used as an accompaniment. So it is a combination of both the instrument and the voice and the music. Williams' model, this methodology does not focus on instrumental education. Instrumental education is not an end in itself, but a means of musical expression. It establishes a difference between the learning to listen to music and appreciate the music and learning to practice the music. So this model will help you to learn a different types of the musics and sounds, and thereby you can use the instruments in a proper way. Of music therapy, based on a child character and behavior, the body is the first and principal instrument, later followed by a small percussion instrument, then orchestra instrument, and finally it was represented with the music language. So in these approaches, how the different types of the instrumental will convert into the music, thereby how you are going to be activated, especially it was given to the children's. Suzuki method, all children can learn music successfully. Parents' roles and group activities are important for the learning process. So this is one of the group activity musics. Early start, children's first years of life are crucial for acquiring musical skills. Listening to the music every day develops one musical ear. So, for example, this type of the group of people, they did a research and they given a particular musics within the age of 1 year. The growth of the child is very fast. So that is called as an Suzuki method. So thereby we're coming to an end. In conclusion, the musical therapy emerges as a promising adjunctive approaches in the prevention of the cardiovascular disease, leveraging the profound impact of music on emotional and physiological well-being. Research indicates that engaging with the music can reduce your stress, you're lowering your blood pressure, and enhance overall heart health by promoting the relaxation and emotional expressions. By fostering a positive mental state and encouraging the social connection, musical therapy not only addresses psychological factors that contribute to the cardiovascular risk, but also complement the traditional medical intervention as healthcare continues to evolve towards the holistic practices. And integrating the musical therapy into preventive strategies could significantly improve the patient outcomes and enhance the quality of life, and you can prevent the cardiovascular disease. So, till now, what we are seeing is a theoretical approaches. Meanwhile, in the part two, we can go for the practical session. So, how we can use a different musics with the pitch sounds, how we can control our the cardiovascular thing. Thank you so much for the people who are be listening here. I hope that a few sentences will help you in your life.
Thank you, Mr. Rajan, for the insightful presentation. Dear viewers, if you have any question for Mr. Rajan, please leave a comment. Okay, and also please fill out the survey form available at the bottom of this webinar. An e-certificate will be awarded upon completion. So you may pose your questions.
So the question is,
Is it specific music to specific cardiovascular disease? How to implement?
it's a very good question. So, as per the approaches, we found that the classical musics, especially when you're going for an low pitch sounds, it will be more beneficial. And also, they can find out that they're having some, not only some, there is a good changes, physiological changes in the cardiovascular.
Okay, so I believe there's no more questions posted by our viewers. Okay, we have now reached the end of today's session. Thank you, Mr. Rajan, for joining us today and sharing such a valuable information. To our wonderful audience, thank you for being part of this webinar. We look forward to your comments and participation in future events hosted by MAHSA University. For any further queries, you can contact us through the MAHSA website or visit our social media platform. Have a great day ahead. Thank you so much.
Thank you, Ms. Nitya. Thank you, Mr. Nelson.